Hey everyone, this is Angel at Alternative Health. It's no shock that 75% of Americans read their cell phone while they're on the toilet. But reading your phone on the toilet can be bad for your butt. The reason is when you are scrolling through Instagram, you tend to stay on the toilet longer than you would normally. So, why is this a problem? Well, according to Dr. Stoller, a Harvard gastroenterologist, I can't say that word, unlike a chair, which gives you support, your bottom hangs down into the toilet, and this allows the rectal tissue to relax and fall. Dr. Stoller lists 4 things that can happen from sitting on the toilet too long. Number 1, you're more likely to get hemorrhoids. When you're seated on the toilet, you are exposing your rectal area to focused direct pressure, especially if you are straining to have a bowel movement. This pressure closes off your hemorrhoidal veins, so the blood pools in them and causes them to bulge up, similar to the way the blood vessels in your arm bulge up when you're getting blood pressure cuff. That tightens around your arm. You know how that'll happen when you get a buzz on your bicep. So in addition, as you get older, the tissues cushioning the veins might weaken. They can become floppy and are more likely to get in way and protrude. It's interesting to note that as a rise of hemorrhoids in young people and in general have risen in direct relation to the cell phone use. So ask yourself that. Number 2, constipation. It sounds counterintuitive, but taking your sweet time on the toilet could actually lead to constipation. How? Well, habitually whipping out your phone whenever you are on the toilet sends a message to your brain. You're training your brain that sitting on the toilet no longer signifies that it's time to move your bowels. Instead, you're forming a association between like the toilet use and your phone life. So it's how you're watching TV in bed can make it harder to sleep. It's harder to sit on the toilet and go to the bathroom. Number 3, you might tear your butt. A tear in the lining of the anal canal is called a fissure. When you have a fissure, it causes the sphincter to involuntary spasm close. This leads to difficulty going to the bathroom because you are pushing against basically a shut door. And number 4, your rectum could fall out of your anus. I know this sounds horrific, but sitting long periods on the toilet can cause rectal prolapse, where a portion of the rectum actually drops out of the anus. So what do? Well, there are no hard and fast rules, but most doctors agree you shouldn't sit on the toilet longer than 3 minutes. The consensus is if you can't go in 3 minutes, get up, move around, try again later. The source of this information is Livestrong. These statements have not been evaluated by the FDA. This is not intended to diagnose, treat, cure, or prevent disease. Thanks for listening.